Hello Joyful Ones, I'm Joan Craig with Choose Joyful Health, and today I'm delighted to be here with Eric Oftenkamp. He is my healthcare practitioner and a colleague, and he is a doctor of Oriental medicine. And I'll let him share with you in a moment what that means and what his scope of practice is. So today we're going to talk specifically about health conditions and problems that come up after the age of 50. And we're going to talk a little bit about vertigo, also back pain and degenerative disc disease, and also menopause. So let's let Eric tell you a little bit about his background and what he does.
Thank you, Joan. Very nice to be here. And I was trained in New Mexico. I have my Master's of Science in Oriental Medicine. I have my license still in New Mexico, and my title there is a Doctor of Oriental Medicine. In some states, it's just called a licensed acupuncturist, which technically I am in South Carolina. The difference being that not every state requires herbal education and training. So New Mexico and other states require that as a part of becoming licensed. And so I have taken the National Acupuncture Board and the Herbal Board as well. And that's a huge part of what I do. So I say I'm not an acupuncturist, but I am a doctor of Chinese medicine because I'm diagnosing, treating both with herbs and with hands-on therapies.
Also, the hands-on therapy it's not just acupuncture. You also do some work with your hands.
Correct, and it's very common in China as well to complement any treatment with hands-on body work. It's called Tui Na, which is a form of Chinese body work. It's very therapeutic, and I got training in that, and I actually continue to teach seminars at schools and just for professionals, and incorporate that quite a bit into my practice, especially when it comes to treating pain, but also any other condition that might benefit from that as an adjunct therapy.
So let's get right into it. Let's dive into vertigo and tell us what your perspective is on vertigo and what kind of treatments you would use.
It's a great question. The reason I chose that topic in particular is because I've had a fair amount of success with it. I've also had personal experience with it. And so to discuss sort of the causes of it from Chinese medicine, essentially we call that internal wind. So if you think about it from a standpoint of nature, which we're always using nature sort of as our language of metaphor for describing what happens in the body, wind affects the upper part, right? The leaves go, so in our bodies, the head gets affected.
So almost
and there's
like
this movement.
There's a tree planted, and when the wind blows, the head of the tree is moving. And even in vertigo, someone's head is actually not moving, but they feel like it is.
They have that sensation.
So they have too much wind in their head.
Yeah, and so my job is to figure out why is that wind there. Okay, so I know it's there, but how do I treat it? And in order to treat it, I have to just sort of whittle down the different causes that it might be. And so one that's very common is to get phlegm or congestion. Even a doctor will say, okay, I'm going to give you, say, guaifenesin to thin out the mucus and see, or a decongestant. Exactly. And so the same as with my medicine, I might give them an herbal medicine that's drying up some of the phlegm, at the same time helping to bring things down and settle that sense of movement in their body.
So how would you assess the patient to see if they had too much phlegm? Like just asking them or listening to them?
A little bit of both. I'm going to listen to their sound of their nasal passage. Do they sound like they're congested? Or I'm going to ask them, do you feel like your ears are full? Do you feel like you can hear well out of both ears? Or does it feel like they're plugged up? Have you had a cold recently? If they don't sound that much like it, are they recovering from something like that? And then sometimes the pulses and or the tongue will confirm that.
That's right. So you check the pulses and you always look at the tongue. And then, so tell us a little bit more about the herbs. Like, are they, what kind of, are they plants? They're just plants?
There are all sorts of different substances that are used in Chinese medicine. So you've got plants, you've got flowers, seeds, minerals,
Like roots?
roots,
Yeah.
barks. Like a not familiar one to everyone is cinnamon bark. And there's cinnamon root, and they have different properties.
So that's good. So the herbs dry up the mucus and the phlegm, and you've had success with patients who had vertigo.
Yes.
Wow.
I had, in fact, a gentleman who came, had really good results, and he ended up sending his brother to me who ended up having the same condition.
Oh, wow.
And which is odd because it certainly is not a genetic or a hereditary condition.
Just happened.
But same family, maybe same type of lifestyle, same type of diet, creating the same similar type of issue. But acupuncture in and of itself can be very powerful and oftentimes very effective in and of itself to bring down an acute attack.
Oh, like the vertigo's going on and it helps in the moment. So tell us about that. Like, how does that work?
So basically, all of the points, they've categorized them as having a specific function or effect in the body. So there are points that help to settle that sense of movement. So I'll use that in combination with points that might affect the movement of phlegm as well.
Wow.
So again, that depends on each person and their presentation.
There is no acupuncture cookie cutter program. It has to be customized to each person in that day.
Exactly. I can look at my materia medica and look at all the points that settle internal wind or treat vertigo, but unless I know what's causing that and I know that person, are they hot-natured, are they phlegmy, are they oily, are they dry, are they cold? All those things will affect what type of treatment I give and how effective it is. So people take things for a certain condition a lot of times now that we have the internet and a lot of information available, and they'll say, well, I heard it was good for this. And I always caution them, it just depends. There's no such thing as something natural that can only just help you. It has to be appropriate for your particular body, so it's not, if it's not done in the concept of the context of your constitution, then it could create other symptoms.
There is no one magic pill for everybody.
Exactly.
So before we got on camera, you were telling me about a patient you had who had vertigo, but it was related more to musculoskeletal pain and alignment.
Correct.
And that was, tell us about that patient.
Well, she came in with all sorts of different pain. She came in with neck pain, shoulder pain. It was very strong.
All up here.
All up in the upper back and neck. That was causing regular headaches. And when it got really severe, she would get episodes of vertigo. And she also had low back pain and hip pain. And so I primarily just worked with her pain. And I didn't need to give her any herbs in that case because the acupuncture was effective enough at releasing the muscular tension in her body. And therefore, her brain could get the proper nourishment it needed, and she didn't have the symptoms of vertigo.
So just to sort of wrap up the vertigo piece, it's too much wind up in the head, and so you're looking at why is that wind there. It could be from phlegm, it could be more from musculoskeletal alignment. Is there any other cause that you've seen where the person might have vertigo?
It could be that they're in menopause and they're very hot and very dry. So that could be an issue.
I'm sighing. I'm like, oh no, I have that to look forward to. No.
So in that case, we want to moisten. We want to put some rain, if you will, in the body so that we can calm that down.